All right, now we have a bit of a difficult time trying to capture the true centric, which I think is not happening yet by using the bi-registration material. So I'm going to use a little bit of a different technique. So I'm going to spray these down. And I'm going to introduce these back on the articulator. Let that sit there for a bit. And I'm going to use a little bit of the base plate wax to reintroduce a bite rim on both sides, and we're going to have the patient bite into the wax. And once we're comfortable that he's biting bilaterally into the wax, then we can create a little box again, just like we did at the jaw relation appointment, and have him bite down back at the centric. So I'm going to use my articulator because of the fact that these two, the centric relation is very close right now. I can use this to kind of guide me how much wax I need to add on there and on that side. So a little bit of wax. I'm going to roll up some wax here. And before I do that, just going to pad dry some of the water residue here. I'm just going to heat up the end of the wax here a little bit and just roll it somewhat. I don't need a lot. I can fold it within itself here too. Cut off this little piece. So basically I just want to add a little piece here. So this is a little bit too big still. Cut that off. I can heat this up over the Bunsen burner a little bit, so kind of melt the underlining surface so it adheres to the existing base rather nicely. And then, I'm sure you're all laughing by now, I'm sure. And we'll get that to close into the articulator. And I'm going to seal around the outside with a little bit more wax. And so almost creating a bit of a rim surface right there. Okay, put that aside so it doesn't fall again. And I'll take this one out now. And we'll seal that down. Inside and out. So you can see here that the upper occlusal surface has made a little imprint on the wax itself. So the excess amount, I'm gonna trim that back a little bit. We'll seal that down so it doesn't move on us. So creating a little bit of a bite pad here. So the patient has the sensation of biting down with their back teeth, which is very important in order to capture the centric relation, right? If you only have interior contact, then you're promoting a protrusive movement. So from here on, what I'm going to do, I'm going to take my surgical blade and just cut off a little bit of the excess past the imprint, just like we did last week with the two wax rims. So we have a little mini wax rim on here. So I'm going to place this back on here. I'm going to do the same thing with the other side. Just roll it up maybe just a couple times. I'm going to cut off the little piece here and fold it against itself. Cut it to size so it fits the scenario right about here. And then I'm going to melt a little bit of the underside So we have nice bonding between the two layers. And very important that this part of the wax is relatively soft, so when I close it, it gives. Okay. So I can cut off the excess here, and then we'll melt it into position. Now before I pry things apart, I can chill the wax so it hardens a little bit so it doesn't adhere to the upper base. Chill the whole thing under water. Just pat it dry. Okay, so now I can pry this out. Let's see if it gives. So that's good. Set this aside, and I'll take this one off. I'm going to cut off the excess here. So I want a relatively flat surface. Once again, I want the patient to be able to slide anywhere he feels most natural. And I'm going to seal this down. You know, I heard a saying one time by a fellow colleague that used to work here for many years, Mr. Mike Vicalis, and he had many words of wisdom. And one particular phrase really stayed with me. And what he said, you can spend your time making a denture, or you can waste your time adjusting it. So I like to think that I'm spending good time here making a denture, because if I do, there's very little adjustments in the end. And the whole idea is to possibly with 1 or 2 adjustments, primarily on the lower, get our patient here to enjoy wearing his dentures. Otherwise, he'll be here every week, week after week, month after month, needing adjustments all the time. And that's not the way to operate. All right, so I've created a nice pad here. So before I place it in Robert's mouth, I'm going to soften up the top layer again, utilizing the alcohol torch, if you recall from last week. And now I'm kind of blending in the layers. I'm going to let that settle a little bit, and I'm going to introduce some more heat once I get the upper one in the patient's mouth. So I'll soften up his back portion completely, and we'll ask the patient to make some imprints in here again. And once we do, we're going to cut off the excess and then make our little box again. All right,